Okay, so let's pick up where we left off with the action potential. So we left off talking about the double-gated sodium channel and how that was important to prevent backward flow of the action potential. So by having the second gate closed, it prevents um, the positive charged ions from going in the wrong direction. The other reason that this double-gated sodium channel is important is that it creates what's called a refractory period. Now, the term refractory period just means an amount of time in which it is either impossible or very unlikely that another action potential will be able to come down the axon. So we're going to see that there's what's called an absolute refractory period, and that means no matter what kind of signals are coming to that neuron, when the neuron is in the absolute refractory period, it is impossible for another action potential to be generated. Then we'll have the second term is called the relative refractory period, and that is a period of time where it becomes difficult but not impossible for another action potential to be propagated at that time. And we'll see why one of them is absolute and one of them is relative. So if we come back to the idea of the double-gated sodium channels, we'll see that the absolute refractory period, so absolute, occurs when the sodium gate is closed, right? And so this is what we were talking about. It prevents backward flow of current, but it also prevents another action potential from coming down the axon before the first one is finished. Because that sodium gate is closed, even if there's a change in voltage in the axon that would normally lead to an action potential, because the gates are closed for a certain time period, they are not able to be reopened until that refractory period is over. So when the gates are closed, when the sodium gate is closed, we would call that the absolute refractory period. There is no way for another action potential to be generated in that time. So if you look over here, and we go through the looking at the action potential based on the relative charge inside the axon, we can see that at the beginning you have the resting membrane potential, that's at negative 70. And then your graded potential, once it reaches that threshold, remember, which in our example we're going to say is negative 60, then that's going to open those double-gated sodium channels, allow for a rush of sodium to come in, and you're going to see a rapid depolarization phase. Okay, now when this is going on, you are not going to be able to have a second action potential come down, because remember what's happening when the one gate opens and allows the sodium to come in, the second gate begins to close. Remember that? So up here, when you get to the peak, that first gate that was initially open is going to close. And that's going to prevent backward flow of the current, but it's also going to prevent any new action potential from allowing sodium to rush into the cell. And then we're going to have depolarization. This was the depolarization when the sodium's rushing in. Then when the sodium gate closes and the potassium gates open, so here's when the potassium opens, you're going to start to have repolarization, right? But during this whole time, you see in the red, the absolute refractory period, during that whole period of time, which is, I think it's like 200 milliseconds, those sodium gates are closed. So no matter what signal comes to the axon, those gates cannot be opened until that 200 milliseconds is over. So that's going to be an absolute refractory period because the sodium gates are closed. Okay, once the cell begins to repolarize, the sodium gates then go back to their resting state, in which case they could be triggered to open again and cause another action potential, and that's going to begin right at about that point, right there. But what happens is, remember we talked about you get kind of an overshoot when the potassium channels open and the potassium leaks out of the axon in order to restore the resting membrane potential. you actually get leakage of too much potassium, and you actually get a hyperpolarization of the cell. It becomes more negative than it is at rest, and that's this area here from here to here. You can see that it's actually more negative. So during that time period, it is possible to have an action potential, meaning the sodium gates are now ready to respond. They have finished their cycle and they're back to their normal resting configuration. But because the cell is more negative than usual, it would take a larger than normal stimulus in order to create a new action potential. So it's still a refractory period, but it's not absolute. It's not impossible, it's just difficult. So we call it a relative refractory period. So if you can remember, the absolute refractory period correlates with the sodium channels being unable to be opened, and it's absolute. There is no way to have a second action potential during that time period. And if you can remember, that occurs during depolarization and repolarization. Okay, then if we move over to the relative refractory period, that's going to start just as the cell is beginning to approach its resting membrane potential, as the sodium channels are open and leaking out sodium. I'm sorry, I said that wrong. As the potassium gates are open and leaking out potassium in order to restore the membrane potential. The sodium gates return to their resting configuration and they're able to be triggered, so it's no longer an absolute refractory period, but it becomes relative because of the hyperpolarization. So if you remember, the hyperpolarization from the outflow, or what we call efflux of potassium, causing a more negative than usual potential, that's causing a relative refractory period. So this is a great picture. If you guys can kind of wrap your head around this picture, this is going to be this will be really helpful when we do lab on Tuesday, but this will be kind of similar to what we're going to do in lab. We're going to look at, for example, all of these channels opening and closing that you see up here on the top, and we're gonna demonstrate through video how the opening and closing of these sodium and potassium channels ultimately leads to the depolarization, repolarization, and hyperpolarization of the axon membrane potential. And then you can put all that together with the absolute and the relative refractory period. And that should help you put it all together. So nothing new on this slide. I just think it's a great slide for putting everything together, and it comes from a different book, so you won't find this in your textbook, but I thought it might be a helpful picture. Certainly look at it in terms of what's happening with the channels and the electricity. Okay, let's look next at just kind of a summary of what's the difference between a graded potential and an action potential. So we're going to spend most of our time in the course talking about action potentials and how they are a form of communication, and they become a trigger for muscle contraction, for signals in the brain, for even signals in the endocrine system sometimes. But graded potential, remember, is kind of a local response to the opening of a local ion channel, and it's graded potentials that typically lead to an action potential. So if you can look at this table and see what the differences are, remember, for a graded potential, there's not really a threshold. It's just kind of local current flow, whatever ions make it into the cell at that one localized area, and that will change the membrane potential in that one area. Action potentials, on the other hand, are all or none once threshold is met. Remember that. Graded potentials, the other important thing is that they may be depolarizing like action potentials. Action potentials are always depolarizing. But some graded potentials actually either allow positive out or allow negative in, and they can actually be hyperpolarizing, which would actually inhibit a cell from firing an action potential. So that's one of the big differences here between a graded and an action potential. Let's see, there's no refractory period. That's kind of a big key versus the refractory period in action potentials. And graded potentials can occur in really any plasma membrane. whereas action potentials only occur really in neurons, muscle, and some, I'll say glandular, some gland cells. All right, another big concept in neurology, and where this is kind of the beginning of neurology or the nervous system physiology. When we're talking about action potentials, there's really kind of two forms of action potentials in nervous tissue. So the one that we've been talking about would be unmyelinated. It's kind of simpler to understand. It shows the charge, the change in potential, as kind of moving steadily down the axon with gated channels kind of evenly distributed all down the axon. And that would be the demyelinated one. We're going to see that conducts slower, so that electricity moves down the axon slower. So we talk about conduction, we're talking about the movement of the charge down the axon. And we would call that continuous conduction. That's what we've been seeing. Sodium comes in, spreads to the next area, opens the next sodium channel, more sodium comes in, spreads to the next one, right? So it's kind of continuous, right? You have your sodium, comes in, spreads to the next one, opens that gate, more sodium comes in, spreads to the next one, opens that gate, more sodium comes in. And you can see it's kind of a continuous propagation of that positive charge. We're going to focus here for a couple of slides on the, myelinated axons. So myelinated axons are axons that have been covered, coated almost with a fatty substance called myelin, and that fatty substance is produced by Schwann cells in the peripheral nervous system or by oligodendrocytes in the central nervous system. And those supportive cells that are that are right next to the neurons will kind of wrap the axon in this fatty substance. And that fatty substance, the ultimate goal of that or result of that is that you get faster conduction. So I would say that's the big takeaway here, is that myelinated neurons, myelinated axons is a better way, because the cell body is not myelinated, just the axons are. The axons that are myelinated have much faster conduction. That means that electrical signal moves much faster down the axon. Now this becomes really important if you can imagine an axon that's going from your spinal cord all the way down to your big toe. That's one long axon, and you would want that message. Let's say your toe steps on a sharp piece of glass. You want that signal to be sent very rapidly back to the spinal cord so that you can feel the pain and remove your foot. Without myelin, it would take much too long for that signal to get there, and we would be injured much more often. So myelin is really important, especially for those longer axons. But there's something different about this kind of conduction. Instead of being continuous like we saw over here, the conduction in a myelinated axon is discontinuous, or what we call saltatory. The word saltatory means to jump. And we'll see here on a picture what that looks like. But basically, if we're showing this as a axon, and you've got it kind of wrapped in myelin, what you see is that there's small areas right here and right here where there's no myelin. And in those unmyelinated areas, that's where your sodium channels and potassium channels are located. So only at those points on the axon can sodium enter the cell. So when the depolarization reaches a gate, sodium comes in just like it did with the demyelinated axon over here. But notice there are fewer of these doors, fewer of these gates, so to speak. So as the sodium comes in here, it can quickly go to the next gate and allow more sodium and quickly go to the next gate. And so what you get is more of a jumping kind of electrical signal. And hopefully we'll understand a little bit better as we go to the next pictures. But we call that saltatory conduction. Instead of being continuous with lots of gates next to each other, you have gates that are kind of spread out along the axon, and so it looks like the charge is jumping from one gate to another gate. All right, so we're going to look at kind of our normal continuous axon again here. And so once we have an influx of sodium, that will depolarize the area right next to it. So you can see we call this local current flow. So these sodium ions are going to spread out, and as they spread, they will change the voltage here from -70 to -60. And as they change that voltage, you're going to then get sodium sodium channels opening here, and sodium will rush in. Then that sodium will move and change this -70 to -60, and then sodium channels that are here will open and sodium will come in. So that's what we've been looking at. Nothing really new there, but just to review that, we're going to see on the next slide what happens when you have myelin and you have kind of spaced out sodium channels that aren't so close to each other. So same idea here, kind of similar picture. And you can see up here what we mean by the axon being wrapped. So notice the cell body has no myelin. The myelin is the yellow stuff. And so you can see that the axon is kind of wrapped in this yellow stuff, except for these few areas in between the myelin. And we call those nodes of Ranvier. So at the nodes of Ranvier, that's where you're going to find your sodium channels. Same kind of sodium channels, it's just that they're spaced out. And so if we look at the picture down here of kind of the charge that's going through, we'll start again over here with an action potential beginning and sodium rushing in. Now notice this myelinated area, there are no sodium channels. So there is no waiting, so to speak, for doors to open and sodium to come in. If you come down to number 2, you'll notice that that sodium ion still travels like it always does by local current flow, but it doesn't have to stop and wait for more doors to open, right? There's no doors there, there's no gates there, there's no channels there. So as soon as that charge reaches the next node, sodium is able to rush in. As you see in the next picture here. So no sodium comes in here because the myelin doesn't have any gates. So sodium can only rush in where there is no myelin, in between the myelin sheaths. We call those the nodes, and that's where sodium will come in. So it looks like sodium came in here, and sodium came in here, and sodium came in here. So it looks like that conduction is jumping. We call that saltatory conduction. So the reason that it's faster, we'll see if I can demonstrate it here for you. Let's say that I have an unmyelinated axon. And so I've got sodium gates all along, okay, this axon. So when this area depolarizes, becomes positive, then sodium comes in, right? And sodium moves in this direction, and then that allows this gate to open, and sodium moves in, and then sodium moves. Now remember, sodium's also moving this way, but that gate has been closed, and so it prevents backward flow. That's what we were talking about with the double gate. Okay, but you see I kind of have to wait for the sodium to get to this gate, and then it triggers that gate, and then I have to wait for it to get to this gate, right? And then it travels, and then I have to wait for it to get to this gate, and then sodium. You can see how long it's taking me even just to draw it out. Now let's draw a myelinated axon. Okay, we've got myelin wrapped around, and myelin wrapped around, and myelin wrapped around. And so let's say I get a positive charge here, so sodium will come in, right? and then that sodium moves here, and I get sodium that comes in, and that sodium comes here, and I get sodium that comes in. I mean, you can see even from the amount of time it took me to draw that it's much faster for the sodium to make its way into the axon when you have fewer gates. Just think about a guy who has to open up 10 doors in a row or a guy who has to open up only 2 doors. I mean, which job will he complete faster? Clearly the job that he only has to open up 2 doors. That's going to be a much faster way of getting that positive charge in. So it's just an issue largely of opening up fewer gates. So it allows the charge to be propagated faster. But if you're looking from the outside, you're going to see charge here, and charge here, and charge here. So it looks like the charge is jumping. That's where that term saltatory conduction comes from. And if this is still a little bit confusing, we can talk about it a little bit more in lab on Tuesday. There's also good videos, like Khan Academy has good video on myelin. You can find other good videos on myelin and how it changes the conduction, if you're still not clear after this video. Okay, so moving on then to the end of the action potential. So we're still under the big category of action potential, and we saw how it starts with a graded potential in the neuron, in the cell body of the neuron, and if that graded potential reaches threshold at the axon hillock, so let's draw a picture here. This is a simple neuron, and this guy has dendrites, right? So you're going to get a graded potential in this area, and it's going to spread out. And if it spreads to the axon hillock, right here, axon hillock, and reaches threshold, then you're going to get an action potential, right? Going down the axon. Now the end of all that, what's the purpose of the action potential? Remember, the action potential is a change in charge. It's going to send a positive charge to the axon terminal, which is this end part of the axon, okay? And that's kind of what we have a picture of here. So as that positive charge reaches the axon terminal, it's going to finally trigger some communication, and it's going to do that by releasing neurotransmitters. So remember, neurotransmitters are just proteins that are used for communication from one neuron to another, or from a neuron to a muscle cell, from a neuron to a glandular cell. So the point of the action potential is that it reaches the axon terminal, causes a change in charge at the terminal, which then leads to the release of neurotransmitter. And then these neurotransmitters, when they're released, they're going to land on a receptor and cause a change in the second cell, in the postsynaptic, we call the postsynaptic cell. In this case, it's a postsynaptic neuron. Okay, let's look step by step how that works. So as the axon terminal becomes more positive, you have voltage-gated calcium channels. Remember, voltage-gated channels means they open in response to a change in the charge. So that action potential brought a positive charge into the axon terminal. When that terminal becomes positively charged, that's a change in charge. And these calcium channels, sorry, I covered up the calcium, are voltage gated. So when they sense a change in voltage from the action potential, they open. And when they open, they allow calcium to enter the cell. Okay, so that's kind of step number 2. Step number 1 is getting the action potential to the neuron, to the axon terminal. Once the change in charge is recognized, voltage-gated calcium channels will open. This then allows calcium to enter the axon terminal. The calcium that comes in triggers exocytosis. So you remember this term exocytosis was a type of vesicular transport that moved things from inside a cell to outside a cell through the movement of vesicles. So in this case, these vesicles, they contain a neurotransmitter. And in the example, the neurotransmitter is acetylcholine. You can see from the ACH. So the acetylcholine has been stored inside the vesicles, waiting to be triggered by calcium. So once the action potential came to the terminal, and that change in voltage opened the calcium channels, calcium came in, and that calcium then triggered the exocytosis of the neurotransmitter. So now those neurotransmitters are moving towards the cell membrane. They're going to fuse with the cell membrane, the vesicles will, and it will release the neurotransmitter onto the postsynaptic cell. Once that neurotransmitter is released and binds to the postsynaptic cell, it's going to create a graded potential. Not an action potential, a graded potential. Now, if that graded potential is depolarizing enough that by the time it makes it to the axon hillock, it reaches threshold, then you will create an action potential. But at this point, it's just a local change in charge due to the opening of these channels, which are, by the way, chemically gated channels, right? And try and keep this straight. The presynaptic neuron at the axon terminal, it contains voltage-gated calcium channels. So they open in response to the action potential coming. But when they release their neurotransmitter, the neurotransmitter binds to receptors on the postsynaptic cell. And when that neurotransmitter, which is a chemical, binds, it causes the opening of ion channels there. So those ion channels are also gated, meaning they responded to a signal in order to open, but that signal was not electricity, that signal was a chemical. In this case, a chemical which is the neurotransmitter acetylcholine. So these are chemically gated channels, which are different from the voltage-gated channels we were talking about in the axon. All right, so once these chemically gated channels open, they allow, let's say, sodium to come in. They may allow a different ion to come in, and that leads to a graded potential in that area. And that graded potential could result in an action potential, or if it's not strong enough, it will just kind of fizzle out and no action potential will happen. Okay, so you have to have a way of stopping the neurotransmitter from continually signaling the postsynaptic cell. Otherwise, we won't have the specificity that we want. Remember, what's great about neuronal communication is that it's fast acting and it's very specific and it's short-lived. So you don't get the same signal over and over and over again. Well, as long as there is neurotransmitter floating around in that synaptic cleft or that synapse area, you're going to have the possibility of those neurotransmitters landing on receptors on the postsynaptic cell, opening up chemically gated channels, and a continuous graded potential to form. So the body has to have a way of removing that neurotransmitter from the synapse in order to stop the communication. So there are three ways that the body gets rid of neurotransmitter from the synapse. So the first one is by having an enzyme that's kind of secreted and put in that area, and that enzyme will take the neurotransmitter and break it down into component pieces. And once it's broken down, it can no longer land on the postsynaptic receptors. Excuse me, so the signal stops. A second way is for a mechanism in place for neurotransmitters to actually return. If we blow this picture up a little bit. So you can either degrade it. Here you can see the enzyme is kind of breaking down the neurotransmitter into its component parts. The other way is to actually have a mechanism for these neurotransmitters to be reabsorbed back into the presynaptic cell and then put back into vesicles. So that's another way to remove those neurotransmitters from the cleft. And the third way would just be for those neurotransmitters to eventually drift off out of the cleft and be taken up into the blood supply or elsewhere. And so eventually all of these neurotransmitters will be either be used up, or will be broken down, or will return to the original neuron, or will diffuse away from the synapse. And that's how you break away, or that's how you stop the signal. And so you can see 1, 2, 3 ways there. Okay, so I wanted to end this lecture just introducing a few of the neurotransmitters that we will see in the course, and we'll see them come back again in this unit when we talk more about the nervous system. We'll see a lot more of these, but we'll also see some when we get to the hormonal section and other places. So you'll start hearing some of these neurotransmitters, so I want you to get used to hearing them. Just learn a little bit about them so that they don't seem so foreign when you hear them in the rest of the course. So norepinephrine is a neurotransmitter. So all of these neurotransmitters are made up of proteins. And norepinephrine is one that is particularly excitatory. That means it's going to lead to action potentials. It's going to lead to depolarization. And we're going to see it a lot. It's going to be the main neurotransmitter of the sympathetic autonomic nervous system, and we'll see that later on in this unit. It's also involved in attention, so helping you stay stay awake, and a little bit involved in body tension as well. Body temperature as well. Clinically, we use it for patients who are in shock. It helps to increase their blood pressure and their heart rate. Acetylcholine, that's the one we've been talking a lot about. We're going to see that a lot with muscle contraction. That's going to be the main purpose that we're going to look at. But it is also involved in the parasympathetic autonomic nervous system. So you can see norepinephrine was with the sympathetic system, and acetylcholine is with the parasympathetic system. And we'll see that when we talk about those systems later on in this unit. Okay, a few others here that we won't talk as much about, so it's good to learn about them here. Dopamine is another neurotransmitter that's involved in muscle coordination. So we see that in patients that have Parkinson's disease. They're either low in dopamine or the cells that are supposed to be using the dopamine have been damaged. And so we actually give people with Parkinson's, we give them a form of dopamine called L-DOPA, and that helps with some of their symptoms. We also know that dopamine is involved in schizophrenia as well, but it's a lot more complicated than we can discuss in this class. But if you just want to have a couple of examples there, you can see dopamine is involved in Parkinson's and schizophrenia. In schizophrenia, it's probably high, and in Parkinson's, it's probably low. Okay, serotonin is another one. This one's really important for mood. A lot of the drugs that we use for depression and anxiety and obsessive compulsive disorder, they have effects on serotonin. They also may affect other neurotransmitters like norepinephrine. But serotonin is kind of the primary neurotransmitter that we're concerned with in mood disorders. It's also involved in pain. So people who have chronic pain, fibromyalgia, they get chronic headaches, chronic migraines. We're finding that if we give them medicines that raise serotonin levels, we can actually help with their pain syndromes. So it does have a bit to do with our pain experience as well. GABA, I just want to mention because it's the one that's really inhibitory. That means it's going to try to prevent action potentials. So when it is received by a postsynaptic cell, that postsynaptic cell will be less likely to create an action potential. So you can kind of think of it as the calming or the quieting neurotransmitter. And so, for example, drugs like Xanax and Valium, they stimulate this receptor, and that's why people who have high anxiety, if we give them Xanax or Valium, they kind of get relaxed and calm down because we're stimulating GABA receptors. Alcohol also stimulates GABA receptors, and that's why we call alcohol a depressant. When you drink enough alcohol, you get kind of sleepy, and eventually you would pass out if you have too much alcohol because you overwhelm those GABA receptors and action potentials are not able to be fired. Personally, as a doctor, one of the main reasons I don't use a lot of medicines like Xanax and Valium is because they are pretty much just alcohol substitutes. And as a physician, I wouldn't tell you if you're anxious, go drink some more beer. So similarly, I really don't prescribe those medicines very much. I would rather prescribe a medicine that affects serotonin and give you more kind of longer lasting relief from those kind of medicines. So anyway, so add this lecture to the previous action potential lecture. If you have any questions after watching these two lectures, make sure you kind of write them down or have a way of remembering to ask me on Tuesday. And Tuesday we'll spend the whole lab going over the process of the action potential, including the release of neurotransmitters, which we just talked about. So we should have lots of practice with this, and it should make even more sense. So I'll see you all on Tuesday. Remember, it's in Browning Theater, which is in the basement of Curry Hall. Same time, though, so I'll see you then. Thanks.